On top of our skin is an oily barrier that protects our skin. In that barrier is a battleground for yeast, bacteria, viruses. We have many good bacteria and yeast battling others, killing them before they can enter our body. This oily barrier is a very necessary defense mechanism for the skin. The skin does a great job of protecting our vital organs from invading forces, but the oily barrier is its first defense. In that oily barrier is very often the wart virus. That virus is waiting for a breach, an opening in the skin to begin to grow on its own. The virus itself is alive on top of the skin in the barrier. However, it can't really develop until there's a breach, an opening, maybe caused by severely dry skin and cracking, or a cut, injury, some opening in the defense. Now, the virus itself doesn't pose any problem until there is that breach. However, one of the failings of the medical profession in curing our wart problem is that they don't tell us to kill the wart virus on the skin. And so their recidivism rate is at least 70%. Killing the virus in that oily barrier is necessary to prevent it from coming back. If we have it on our feet, if we have a plantar wart, then that means the virus is on the skin. And if the wart is on, let's say, your left foot, your right foot and right leg have the virus as well, even your hands. So the first step is to take your Listerine, which kills the wart virus, and kill the virus on the skin. Be generous about it. Listerine is very inexpensive. It won't cause any damage to the skin, and it will kill off the wart virus. If you were to try to bathe or scrub yourself to clean all of the bacteria, all of the yeast, all of the viruses off your skin, it would never happen. You could never kill them all. So we're looking for something that's a little more specific to virus, and that is Listerine. So I'm cleaning and killing the wart virus on both legs, both feet, even though the wart's only on one. Also going to do my hands. And when you go to sterilize anything or kill germs, bacteria, you need to wait at least 2 minutes. Give it time to work. And of course, the skin needs to be dry for the duct tape to adhere. But when you're doing it for yourself and to cure the wart virus, take plenty of time. Don't walk around. Don't travel, use anything else, because the wart virus could be in your bathtub. It could be on the floor of your bathroom, like athlete's foot, things like this. So just stay in your one position, minimizing the risk. Now that we've killed the virus on our skin, we have the plantar wart growing within our body. The plantar wart does not have any nerve endings, so it doesn't hurt. However, the growth of it, the foreign cells are pressing and pinching against nerves, and that's what causes the pain. The body's natural defense mechanism builds up callus around the wart to protect the body from the wart. So if you've had the wart for a while, chances are you have much more callus than you really have wart. And all the callus and the wart put pressure on nerves in an unnatural way that hurt. And that's where your pain comes from. You'll notice if you've tried cutting it out or flaking it off that the wart itself doesn't hurt at all. There's in callus there isn't the nerve endings either. But both of those things put unnatural amounts of weight and pressure on the nerves deeper into your foot, and there's where your pain comes from. The Listerine will kill the wart virus, and we're going to remove the oxygen and destroy the wart. However, that does not kill callus. Callus will be absorbed by the skin, by the body, by the skin, over a period of time. As the body recognizes it no longer has to defend itself from the wart, the callus will slowly be absorbed and be removed. And you will end up with a nice, smooth, healthy foot. So now our virus is killed on our skin. We've waited our 2 minutes. Now we have to remove the oxygen from the wart. Because the wart has no connection to our blood, it can't receive oxygen except from the air. And even in your socks and shoes, there's still enough air for it to live. It doesn't need a lot of air. So we have to seal it very, very well. I prefer gray tape. And I apologize, I don't have it. I can't find my gray tape right now, so I'm going to use flesh tone tape as a demonstration. So now I've covered the wart. However, I want to make sure that my seam, that my edges are sealed. As you can see, I've screwed up my wrap. Bottom, it is secure. But I don't want any cracks on the bottom where the wart is. I want to seal the edges. So I'm going to take another strip. This tape is kind of old. I used it for upholstery. And now I'm covering the one edge. I'm covering the edge, sealing it. The first tape covered the wart. Now I'm sealing the edge. One more strip for the other side of the tape, the edge. Now I have fully sealed that wart. No oxygen can get in. It will die. Tape is on there real good. I can put on my sock, my shoes, go about my life. Now, some days you might be a little more vigorous or sweaty. The tape can come loose. That's okay. Just replace it. The less oxygen it gets, the faster it's going to die. Just because a small time frame caused some air to get to it, don't worry about it. Just go back, do it again, and keep it up, and the wart will die. You will notice inside, in the very middle, usually the middle, The wart will flake out and it will develop a hole. The callus is much more resistant. It takes longer to be removed. So the first thing to go is going to be the wart. And that means you'll have a hole going into your foot. When you're putting on the Listerine, get some of the Listerine into the hole. Make sure that it's liberal. And you can never really be sure exactly when the wart is completely dead. So do it a little longer than maybe you think you need to. And everything will be well. This method is very inexpensive. It's simple to do. Some days you don't have to change the dressing. It stayed secure through a shower, through work. Some days you have to do it 2 or 3 times. The more oxygen you keep away from the wart, the faster it will die. And your skin will return to normal healthiness, soft and supple, and your likelihood of getting another wart soon will be very small. However, like all of us, once it's healed, we will forget to kill viruses on our skin with Listerine, and it may come back. But if it comes back over a period of time because you've reacquired the virus, you'll be able to catch it earlier. You'll know the procedure earlier. It will be a much, much faster event because the wart won't be so deep inside. Be much easier to kill, much easier to destroy, and simple. Thank you very much. I hope this video has helped. Goodbye for now.